Hi, in this video, the topic is branches of abdominal aorta. The abdominal aorta is the main artery which supplies blood in the abdominal cavity, in the organs of the abdominal cavity. So the branches are first, the branches are divided into four types: two terminal branches, three anterior branches, four lateral branches, and five posterior branches, in which four lumbar arteries which are paired and one is unpaired. This is under posterior branches. First, we will talk about two terminal branches. The two terminal branches are right and left common iliac artery. It's right common iliac artery and left common iliac artery. Each common iliac artery will also divide into external iliac artery and internal iliac artery. This is internal iliac and this is external iliac. The external iliac artery which will supplies the lower limb. The external iliac artery will be continued in the lower limb as femoral artery, and internal iliac artery which will supply the associated structures, visceral associated structures of the pelvic region. If you see in the diagram, this is common iliac artery, this is internal iliac artery, this is external iliac artery. It is mentioned here. Next, three anterior branches. The three anterior branches, this will arise from the anterior surface of the abdominal aorta, and they will supply mainly the gastrointestinal tract and the associated viscera, liver, spleen, pancreas, and also the gallbladder is also associated with liver. First, we will talk about the anterior branches. There are three anterior branches: celiac trunk, superior mesenteric artery, and inferior mesenteric artery. The first artery is celiac artery. It will supply the part of GIT, that means gastrointestinal tract, which is derived from foregut. Plus also this artery will supply liver, spleen, pancreas, and also gallbladder. We will see the celiac artery. See, this is the celiac trunk, celiac artery or celiac trunk. Celiac trunk, there are the branches. Here the yellow colored structure is pancreas and it is spleen. The celiac trunk will divide in many branches, and ultimately they will supply all the organs which I have mentioned above. The hepatic proper artery will supply the liver. Then superior mesenteric artery. Superior mesenteric artery will supply the part of gastrointestinal tract derived from midgut, and inferior mesenteric artery will also supply the part of gastrointestinal tract derived from hindgut. I am showing that what are the part of gastrointestinal tract from the foregut, midgut, and hindgut. Here the part up to this portion is starting from the terminal part of the esophagus, the stomach, and some part of the duodenum. This is derived from foregut, and also liver, gallbladder, spleen, pancreas, these are also derived from foregut. After that, from this portion to up to this junction, that means some portion of the large intestine will also derived from midgut, and from here up to rectum anal canal, this whole part is derived from hindgut. Here in this diagram it is clearly mentioned with color codes. Okay. After that, I will talk about four lateral branches. The four lateral branches are inferior phrenic artery. Inferior phrenic artery will supply the diaphragm, middle suprarenal artery, which will supply the suprarenal gland, the renal artery will supply the kidney, and the gonadal artery, that means testicular or ovarian artery. Testicular artery will supply testis, ovarian artery will supply ovaries. You see the lateral arteries. See, this is inferior phrenic artery, this is middle suprarenal artery, this is renal artery, and this is gonadal artery, that means ovarian or testicular artery. After that, the remaining are posterior branches. There are 4 lumbar arteries. There are 4 paired lumbar arteries, that means total 8 lumbar arteries in right and left. Right sided 4 lumbar arteries and left sided 4 lumbar arteries. They'll supply the lumbar vertebra, associated muscle and tissue, and also the skin. 4 lumbar arteries will supply this. Then 1 unpaired median sacral artery. Median sacral artery which will supply sacral vertebrae, associated muscle, and posterior surface of the rectum. See, this is lumbar artery. 1 lumbar artery is marked. There are total 4 lumbar artery, and there is 1 median sacral artery. Median sacral artery. So if short note comes, then you can draw this flow chart with this diagram.